Assalamu alaikum. Now I would like to discuss about the child abuse. Child abuse. All cases of suspected child abuse must be reported to the local child protective service. This is a real word. We have to report it to local child protective service. Neglect. Poor hygiene, malnutrition, withdrawn effect. Poor hygiene, malnutrition, withdrawn effect, impaired social or emotional development, impaired social or emotional development, failure to thrive due to failure to provide a child due to failure to provide a child with adequate food, shelter, supervision, education, and affection. Most common form of child maltreatment, neglect, poor hygiene, malnutrition, withdrawn effect, impaired social, emotional development, failure to thrive due to failure to provide a child with adequate food, shelter, supervision, education, or affection. Physical abuse, sexual abuse, and emotional abuse. Physical abuse, non-accidental trauma like fracture, bruises, burns, injuries in different stages of healing or in patterns resembling possible implement of injuries. Includes abusive head trauma like shaken baby syndrome characterized by subdural hematoma or retinal hemorrhage. Caregivers may delay seeking medical attention for the child and provide explanation inconsistent with the child's development stage or pattern of the injury. What they are saying does not match with the injury. 40% deaths related to child abuse or neglect occur in children less than 1 year. 40% more than 40% of death of child abuse or neglect occur in children less than 1 year. Sexual abuse, STI, UTI, genital, anal, or oral trauma. Most often there are no physical signs. Should not be excluded from Sexual abuse should not be excluded from a differential diagnosis in the absence of physical trauma. Children often exhibit sexual knowledge or behavior incongruent with their age. Peak incidence is 9 to 12 years old. Emotional abuse babies or young children may lack a bond with the caregiver but are overly affectionate with less familiar adults. They may be aggressive towards children and animals or unusually anxious. Older children are often emotionally labile and prone to angry outbursts. They may distance themselves from caregivers and other children. They can experience vague somatic symptoms for which a medical cause cannot be found. And the last is vulnerable child syndrome. Patient perceives the child as especially susceptible to illness or injury versus factitious disorder imposed on another usually follows a serious illness or life-threatening event can result in missed school or overuse of medical services. Vulnerable child syndrome patients perceive the child as especially susceptible to illness or anxiety. That is all about child abuse. So, in child abuse, there may be neglect. First thing, you have to report the local protective. There may be neglect. How you can diagnose the neglect? Poor hygiene, malnutrition, physical abuse can be found, and shaken baby syndrome should keep in mind by subdural hematoma or retinal hemorrhage. Sexual abuse peak incidence is 9 to 12. STI, UTI, or genital tract oral trauma should be looked for. And emotional abuse, babies or young children may lack a bond with the caregiver but overlay affection with less familiar affectionate with less familiar adults. They may be aggressive towards the children and animals and unusually anxious. Older children are often emotionally labile and prone to angry outbursts. They may distance themselves from caregiver or other children. They can experience a vague somatic symptom for which medical cause cannot be found. 80% of the young adult victims of child emotional abuse meet the criteria for one or more than one psychiatric illness by the age 21. And vulnerable child syndrome patient perceives the child as especially susceptible to illness or anxiety. This is all about childhood abuse. Hope you